Chair. And thank you for being with me in this last session, I think. Yeah. So that's my name, Dr. Razitasham Safii. I'm a medical doctor, public health, so I'm human health component. And just to inform you that I am a Malaysian, in case you are wondering why I'm wearing like this, yeah? So I'm Malaysian and I'm working in University Malaysia Sarawak or UNIMAS. So what I'm going to share with you today is the One Health approach in animal welfare. Basically to share a simple version of our community engagement. I think the previous speaker, I think Dr. cannot remember your name already, Amit, right? So I think he's presented a very good community engagement at higher level, but mine is really at community level that I want to share with you. And also I like to thank the organizing committee for called me to share our presentation. So I think before I go, I like to invite also to introduce I have two friends there which work closely with me here, Dr. Rosalia and also Mr. Desmond. So Mr. Desmond is actually from the council and Dr. Rosalia is a lecturer from UNIMAS. Her background is on health promotion. So this is what the outline that I will share with you. I think the previous speaker did mention about the One Health. And for your information, UNIMAS is one of the university under the Malaysia One Health University Network, or MyOhun. And MyOhun is under CHUN. So, so to say that we are practicing the One Health concept in our medical school. Okay, so I will not go the detail of the One Health because the previous speakers already mentioned, but just to briefly, I like to highlight that One Health is not a discipline, but it is the way we work, the approach that you take. And when you talk about One Health, if people ask what do you understand by One Health, to me the most important is collaboration, cooperation, collaboration in anything that you do. And in my case, why am I here? Since I'm a medical doctor, definitely my concern more is on disease. And in Sarawak, be careful when you walk around. If you see any free roaming dogs or free roaming cats, don't just easily pet them because they can be positive. Because we have positive dogs and cats in Kuching. So be careful with that. Yeah? So I don't want anything to happen to you after you finish this wonderful conference. So this is One Health. Okay, so definitely in our case, I'm concerned about human health. And I'm giving the example of rabies in Sarawak. In Sarawak, the government has done a lot of things, vaccination, maybe not much on monitoring, but vaccination, I think they go all out. They exhausted the funds, exhausted the manpower, yeah? The time, until that extent. But presently, our rabies case is still increasing. In fact, for this year, our human rabies is more compared to previous years. And our dog bite cases also is increasing. So another careful that I want to warn you when you walk in Kuching city. Yeah? Okay, so in protecting animal welfare, One Health approach require community engagement, education, and collaboration. So this is a very wonderful word, which actually is not easy to get. Yeah, you must be somebody. The way you approach people for you to get a good community engagement, education, and collaboration. And to me, at the moment, the collaboration part with the other agencies is actually very good, especially with our local council, local veterinary, and also local health department. But now, we know that all those government agencies alone, to handle rabies is not enough. That's why we need community engagement, community involvement in rabies control and prevention. Okay, animal welfare, I will not go in detail because you are more expert than me. I learned a lot from this today's presentation on welfare, how do you all, the wonderful job that you did in to take care of the animals, yeah. But in Sarawak, last time we hardly see, this is crocodile, crocodile on the table as a food. But this photo was taken during our last Kuching food festival. Yeah, you can. Kuching food festival. So now we can eat crocodile in Kuching because there are too many now. But previously, it's actually a protected animal. So this is something that to us is also a worry trend for public health doctors, because every meat carry definitely various germs, and I also like to advise, for all of you, when you are, because you are working closely with the wild animals. Remember the zoonotic disease. Always use at least your mask and glove, because we never know the next pandemic. Usually, new emerging disease is zoonotic in origin. Yeah. So you may get that from your loving animals. So do protect yourself. Love yourself first before your animal. Okay? Okay, so, community engagement. Community engagement is more effective for behavior change. This is the theory said that, and actually it's also a fact. Yeah? You can educate, you can give information, but how good is your education to get your community to be engaged in your program? And definitely you have the step. That's why in this, whatever project that I run, I will need my team members to help me to go through all these stages, from education, engagement, and empower the community. So those are the steps. Yeah? Okay. And especially in Sarawak, where we have different ethnic group, different social lifestyle, different culture of lifestyle. So whatever we do, we must pay that attention to these social factors, yeah, and that is part of what we call the One Health approach. You just cannot simply do so. There is no, I think, as previous speaker mentioned, there is no one model that fit to all. So you must know your people for you to do intervention in that group, yeah. Okay, and also any planned project must create opportunity for community to engage. In fact, not just in the middle of the activity, but involve them in the planning. So I just show a few photos. Being in the university, our strength is manpower. I have my student as my army to do this work, the community project, yeah. And especially when they are postgrad students, because they already are doctors. They have what you call the some of the information in them, yeah. Okay, so if we look at in Sarawak, dogs are parts of the family members. That's how they treat, and in some ethnic group, especially when you go to rural area, dogs are actually, the dogs can eat together with them, yeah, sometimes on the same plate, and definitely different ethnic group. Yeah, in different place, different ethnic group, and you need a different approach. Okay, a bit of theory on the 4 E's of successful community-based approach. Yeah? Education, we educate, we do a lot of education, but I always ask those who do the education, how effective is your education? Effective education should be able to engage the target group. If your education just sort of giving information, so you are actually giving information, not education. Okay? So education is central to the integration of One Health approach. Definitely before the engagement level, our community must know, they must be educated of all the things that we want them to know about the issues. So this is some of projects done by our Kota Semarahan, where Mr. Desmond is. This is involvement with the NGO and also schools. Yeah. Okay. So the step is engagement. The second step is engagement. Means that the people you reach are taking action to do something. So in any program that we do, we must make sure that there are interactive session. There are problem-solving scenarios, not just giving talks, not just giving all those photos. Yeah. Okay. And the third one is enrichment. Enrichment means the community will do specific program, and this is the things that I want to share with you. Even though it's simple, but when it comes to public health intervention, it's actually a very, very important step. Yeah? So example, in community surveillance. Okay. And definitely the next step is empowerment. I think most of your project, you are already in this. I think the speakers from Vietnam, you already in this level, yeah? That the community make a difference. So how I wish my community to achieve this level of empowerment. So at the moment, we are here. Okay. So what we do to tackle rabies in our region, in Sarawak, or especially in Semarahan, where our university is. Yeah? We prioritize the disease under what we call Healthy City Program. So when you have a special project, you park under the Healthy City Program, you will secure some fund. So this will act as a vertical program. And based on our experience, if you do it as a vertical program, that means you have a specific somebody to run, specific budget, specific team, the program will run successfully. And on top of this, we engage our community leaders. From the beginning, we ask them, what is your problem? They know about rabies, but what are your problems in your area? Okay, so during this session, they do their brainstorming. They come out with their suggestion of what to do. Okay, and then we use our student to go for community survey. So based on the community survey, the root cause that we identify are still the low dog license, low vaccination, low neuter, increased stray, so everything low except the stray dog population. Yeah, so all low. In fact, we did not measure education. If we measure education, I think we are not sure whether education is also low. But actually, in our case, most of our population, they know about the education is there. They know about the knowledge, but the attitude are different things. So the attitude actually does not tally with the knowledge. Yeah. Okay. So this is the what we call the One Health issues. Identify the problems before you do your programs. Okay, this is the example of our vaccination card, animal vaccination card in Kuching. Yeah? And then this is example of the BKU Kuching North, what we call MBKS, the municipal council. Yeah? This is their tag for the dog. Yeah? Okay. And we had our something like a workshop, yeah, because we have some budget, because we park this under the Healthy City that I mentioned earlier on. So we have a workshop for all the community leaders, which we target the high risk group. And the speakers are all from the different agencies. We have from veterinary, we have from human health component, we have from council. So they will talk about the what we call the licensing, the neutering, yeah? And also this is our community leaders. At the end of the education that you give, we throw them some problem base, ask them to group together and come out with solution to help us. What should you do as a community leader? So in this what we call tabletop simulation. In this simulation, you will observe the behavior of our local leaders. Some of them in their interpersonal skill, communication skill, leadership skill, responsibility, personal skill, and also the way they think, the system thinking. Some of them, not some, most of them, only a few, the good one which portray leadership. The rest are all government do. That is not our responsibility. So that is the attitude. But and they will give their views and recommendation. So actually this activity lead to engagement. Okay, since my time only left few more minutes. Okay, so this is what our output behavior that we want for community members to register. All those, the low initially, so we want it to be increased. This is our target. And the key message from that workshop is One Health approach. Means when you work as a team, multidisciplinary team. And community makes a difference. And pets' life matter because we advocate the welfare of the animals. Okay, so what we have from the progress, even though not many, I think our total participant was about how many, Desmond? 50, including the staff, right? Okay, but I can say we have 2 community leaders that I can consider a champion. So what did they do to us? What we did was all of them, we create a WhatsApp group in those areas, positive radio, the one who attended our workshop. We have one WhatsApp group which they can convey whatever message or whatever complaint, And their complaint is actually reporting of strays, the problem with garbage disposal, and also the dog bite. So their complaint to us is actually a community surveillance or event-based surveillance in epidemiology. And this can be the beginning of the real outbreak. So to me, as a public health doctor, I'm happy to have this community surveillance. Even though, okay, this is the example of the one guy who always give us information. So I asked his permission that I will show his photo and you are my champion. So champion can lead the community, can make whatever our activity faster. If we don't have champion, for us to go to the community is a bit difficult. So I am very happy, even though the program is only about 1 day program. And on top of that, we have our community training modules. We put all the presentation, convert it into a training modules. And all of us are here. You can see now, Rosalia, Desmond, so that's myself lah. But on top of that, much more needs to be done. Okay, so, and we also have what we call the One Health training. This is in another session. This is under Southeast Asia Network, under TDREC They are arranging another One Health training. So you see students from different faculties, even the lecturers also from different background. And actually it's very, very wonderful. If you can have this training, you always learn from one another. Okay. Oh. I can think this is, okay. And another engagement with stakeholder. This is our Angels Initiative. And what is the NGO here, Mr. Desmond? From KL, right? BI, yeah, BI. They came and help us, give us some fund and do some workshop on health promotion, and also I think they help in the vaccination. So I think that's all from me, and this, thank you very much for your time. Thank you. Maybe you don't have, but I learned a lot from Dr. Amit this morning. So you actually you inspired our program. This is my program. That's why I told Dr. Rosalia we can do the same. So actually I'm learning from you all. Yeah. My community project is very, very simple. But now since our dog bite cases is increasing, so I cakap we should go all out for this community engagement. No more government do. It's very stress, mental health. Somebody talk about mental health. So it's not the human, it's not the animal mental health, but the staff mental health. Time's out. Okay, thank you. Okay, thank you.